So what blood work can we do to make sure or to see if we're having a heart attack? And I want to talk about this a little bit more, and I want to do a separate video on this one because many people think that, if you're having a heart attack or having symptoms of heart disease, remember, I consider it like kind of headache, lightheadedness to kind of jaw, teeth, neck, shoulders, chest, back of the chest, down the arms. I know it's a lot, but indigestion, those are all symptoms of cardiovascular disease. And to see if you're actively having a heart attack, only actively having a heart attack, is looking at your CK enzymes and troponins. And they rise, a little bit delayed. In fact, they get up, but then they stay elevated and they might take a few days to come back down after a heart attack, and assuming everything's okay. So doing that blood work, you only want to do that if you're actively having a heart attack. And that's usually done in an emergency care setting. So urgent care, emergency care, that's where those tests are usually done. Now, if you do that on a preventative basis, those same specific tests, there are other tests that you can do, but doing those tests, looking at specifically the same tests that they look in urgent care on a preventative basis, it's not so valuable. And so you don't want to do the same things that get done in emergency because that's looking for emergent situations. Unfortunately, those same things don't work when we're doing that way. So blood work during a heart attack is not the same as doing blood work to prevent a heart attack. And so even if you've had a heart attack or a heart event, that blood work wouldn't be valuable to you when you're stable. And so it is valuable to you when you're having those symptoms of heart disease or angina pain. Again, Diamond Fernandez here with the Heart Fit Clinic. We look forward to continuing to help you live happier, healthier, and longer.